Okay, thank you, Shavi, and thank you for the opportunity to be here today as well, and good morning to everyone. And today I was challenged with the task to present to you how PRRS and influenza co-infections can affect resilience in the field. And although we're talking about PRRS primarily today, influenza is one of the other more common infectious diseases that we have observed often in the diagnostic lab and what we see out in the field as well. So the chances of co-infections with those two pathogens are very common. So my goal today is to look at some of the data that's been put together experimentally and from the field with co-infections between PRRS and flu, as well as other pathogens that can be involved, and how that has affected productivity and resilience within the pig population in the field. With that being said, the porcine respiratory disease complex is a term that's fairly historic, but it applies as much today as it did years ago in regards to what we see with respiratory disease and the multifactorial nature that's involved with that. Typically, multiple pathogens are involved with respiratory disease, but it's really the complex interactions that would have the dramatic effect on resilience. Within those infectious agents, we usually classify those as primary or secondary, the primary ones being able to cause disease on their own. The secondary pathogens typically need a cofactor in order to be able to manifest themselves as something severe. And then heard a little bit already today about the non-infectious factors, such as the environment, management, genetics, that can also play a role in how we manifest these different disease entities within our production systems. The reason that we're talking again about PRRS and flu as our primarily co-infections today is based on what we see diagnostically as well as out in the field, the commonality of PRRS and flu being detected at the same time in respiratory disease. I think one of the studies done in the past, back in 2007 by Daryl Holtkamp, reiterates this particular fact when he looked at 19 different production systems in the U.S., separated those by phase, looking at breeding herd and then the nursery as well as the grow-finish herds. And as you can see here, that PRRS and influenza are at least one of the top 2 or top 3 health challenges within each of those different production phases. So certainly supporting these severity that we can see with those two factors, those two pathogens being involved within respiratory disease. Coming from the Iowa State Diagnostic Lab, it's always interesting then to take a look at our diagnostic cases that we see and the breakdown as far as the percent of those cases diagnosed with respiratory disease and what pathogens are involved. At Iowa State, probably 75 to 80% of our cases are swine-based, so we're diagnosing multiple different disease entities that are taking place there. And in 2017, if we take apart and look at the percent of pathogens involved either by themselves or as a co-infection in respiratory disease, you can see that by far PRRS is the greatest percentage of those cases at over 37%, and flu consistently comes in as second, anywhere from 22 to 25% of the cases. The rest of the pathogens there on the x-axis would pretty much represent what could be considered some of the secondary pathogens that are involved, but they come in at a much lower percentage, either based on difficulties with detection or based on the pathologist's interpretation of the case at the time that they're diagnosing the disease. But mycoplasma, as you know, is a considerable problem within production systems in the U.S. Other bacteria that can be involved, like Pasteurella multocida, Strep suis, and Haemophilus parasuis would also fall in line there as well. And there's always some cases in which we can see disease, but maybe we don't have a diagnosis, or we can see the lesion, I should say. And the lesion can dictate whether it looks more bacterial or viral, but again, for some reason, maybe we don't diagnose the particular entity. So I wanted to take a look, since we're talking about co-infections, at our cases that are diagnosed specifically with PRRS pneumonia and see what percentage of other pathogens are involved as the cofactors or co-infections in these cases. And as you can see, I guess it wouldn't be much of a surprise, but influenza virus would be the primary co-infection with our PRRS pneumonia cases. And in this situation looking at 2017, it was around 26.4%. And then I think the additional pathogens listed after that along the x-axis would represent a lot of those secondary pathogens that come into play as cofactors as well that a lot of our production systems struggle with. Strep suis is a very constant pathogen that we see often in the nursery that we deal with. And Pathology of is another bacteria that often by itself we don't consider to be much of a player in disease processes, but could be in cases of co-infections. We have mycoplasma listed there and Haemophilus parasuis. After that would be some other pathogens, still important to the industry, but I think those first ones listed there would be those most common and often involved as secondary pathogens. So we'll switch gears and look now at those cases that were diagnosed as having influenza pneumonia. And you can see there as well that over 40% of the cases in which a co-infection was involved, PRRS was the primary agent that was included there. And then really we see some similarities as far as the additional pathogens after that are bacteria that we often again would consider to be secondary pathogens in a co-infection process. So reiterates the importance of PRRS and flu as co-infections together and the commonality that we would diagnose those at the diagnostic lab as well as some of the other agents as well. Another term that's been used to describe co-infections within respiratory disease is polymicrobial porcine respiratory disease. It comes from a publication by Tanya Presnig in 2011, but again reiterates that our respiratory diseases more often are combined or mixed infections with one or more virus or bacteria. Still involve primary or secondary pathogens, so the primary ones we feel can induce disease or lung lesions, in the case since we're talking about respiratory disease based on the virulence of the pathogen. The secondary factors need some type of a cofactor to induce lesions. And many of those could be considered flora of the lung that could be residing there, but again, need something in order to tip it over the edge to let it become a significant player in the disease process. It's also been described as having pathogens of major or minor importance. And our major pathogens would be able to induce disease or lesions on their own, and the minor pathogens require concurrent infection to induce disease. The chart that comes from that particular paper shows the different viruses and bacteria that are involved within the major and minor scenarios from porcine respiratory disease. Of course, PRRS and flu are listed at the top of those of major relevance. And then several of the viruses listed after that would be secondary, and many that aren't considered to be too much of a disease entity within the U.S. As far as the bacteria goes, you can see that mycoplasma, Actinobacillus suis, and Actinobacillus pneumonia, and a couple others are listed of major importance because they can cause disease on their own. But the minor relevance ones listed there would go back to what we saw with some of our primary co-infections, strep suis, Haemophilus parasuis, and Pathology, again being considered more secondary agents than primary. So resilience to PRRS and influenza co-infections is our topic today, or my topic that I am discussing today. And in looking at how we would define this through researching this particular topic for me, going back to '87, there was a publication by Albers that described resilience as the ability of a host to maintain a reasonable level of productivity when challenged by an infection. And I think that's consistent with what Dr. Harding had just presented to us a minute ago. And productivity was included in the trait definition of resilience because of the fact that resilience traits can affect profitability in livestock production. So definitely one of the bigger factors that come into consideration there. Response to infection in domestic animals can be described with other terms. Dr. Harding also mentioned resistance, which is the intrinsic ability to control pathogen burden, so I think that's consistent with his definition. And tolerance is another one, the ability to maintain performance with a known pathogen burden. And oftentimes, though, in our production systems, we may know what pathogens could be involved, but we don't know how much of a pathogen is present within a particular disease entity or situation. So that's the difference between resilience and tolerance being in those cases the quantity of the pathogen is really known. And I think resistance and tolerance together can help combine to make for more superior resilience, but each one, like Dr. Harding mentioned, has its own definition. So another way to look at resilience through this figure, I think, demonstrates fairly well what we're trying to describe here when looking at the performance potential within a production system or a group of pigs, and then how adding in those pathogens or an increasing pathogen burden can affect that performance. So the goal obviously would be to minimize the difference between the two lines as far as if we're wanting to increase resilience. And resilience can be quantified by superior performance at a given infection challenge. So that would be looking at the vertical line, or by maintaining performance with increasing infection challenge, which would be the horizontal line. Measuring the burden of co-infections with polymicrobial disease, most often we're looking at additive effects, which is really the total effect is the sum of their individual effects, and then a synergistic effect would be defined as that total effect is greater than the sum of the two individual effects together. Often the parameters that we're going to use to assess the effects on production would be average daily gain and feed efficiency, as well as mortality. And experimental studies have often looked at some of the molecular mechanisms of pathogen interactions that can affect resilience, looking at effects on lung lesions and also the altered or enhanced immune and cytokine responses that could be involved with those particular cases. So we know that PRRS can definitely have an effect on resilience and production. Holtkamp's study in 2011 estimated the cost of PRRS to the U.S. at $640 million. This was based on field data looking at a large number of U.S. production systems. I think there was over 80 breeding farms and maybe 390 groups of pigs keeping track of their production data. Focusing more on the wean to finish pigs, if you look at the three graphs presented here, the group A pigs would be those that were PRRS negative from weaning to finish, so they did not have a PRRS challenge or burden throughout their production phase. And the group B pigs that were PRRS negative at weaning but positive at slaughter, so at some point they became infected throughout their production phase, and then the group C pigs were PRRS positive at weaning and dealt with the pathogen throughout. Again, this is based on field data, so we don't know the other cofactors involved, but when you look at mortality, you can see significant differences that increase as you go from the PRRS negative pigs to those that were positive from weaning to finish. And then looking at the average daily gain and the decrease that's experienced there when they're dealing with the pathogen burden as well as pigs sold in the primary market. From the influenza aspect, I think that there isn't a lot of data looking at production effects with flu, sometimes maybe a little bit overlooked since PRRS is such a predominant and severe disease to deal with, but Martin Valls in 2016 did a study in Spain looking at different production parameters, again based on field data. And here we're looking at three different groups, again, kind of in the opposite order of what it was presented for the PRRS data. But in the first column of the graphs presented here, you can see these are pigs that were influenza infected or confirmed outbreaks that occurred during their production phase. The second column is the pigs that had respiratory disease but were negative for flu. And then the third column would be our healthy pigs throughout the production phase. So you can see differences again in mortality as well as the time to slaughter in days and time to slaughter weight, in which the healthy pigs perform better obviously than the infected or co-infected pigs. So that sets the stage for really looking a little bit more closely at what data has been presented as far as the effect of resilience on production parameters when looking specifically at PRRS and flu co-infections. And so one of the studies I wanted to present is a little bit older as far as the data from '96, but Van Reeth did a study looking at PRRS infection by itself and then as a co-infection with respiratory coronavirus and 3 different strains of flu. And this chart here presents the data as far as body temperature over time. And so you need to keep in mind that the PRRS-only pigs are going to be the thinner line that's presented here at the bottom, or representing a lower body temperature. And then the thicker line that shows the highest body temperature is the PRRS-infected pigs that were co-infected with the influenza strain number 1. So you can see that over time, in this study, with PRRS being infected first, 3 days later, the co-infection occurred. The body temperature that was significantly higher in all of the co-infected pigs, particularly getting out to day 5 versus the PRRS-only infected pigs. We tend to correlate increases in body temperature with systemic effects, which would be related to inflammatory processes and those different factors that can have an effect or demand on the pig's body system, so affecting production. So definitely a difference here using this particular parameter as far as an effect that can be correlated with production. In the same study, they also took a look at body weight gain over the course of the experiment that was conducted. And again, looking now kind of at the reverse, because we want the pigs to gain the best that had the single infection, or that was the outcome of the experiment. You can see the thin line that's at the top, how the pigs starting again at about day 5, when their body temperature started to decrease, the increase in weight gain was certainly much better than the pigs that were infected with the PRRS and flu strain number 1, but overall better than any of the other co-infected pigs as well. So again, showing where resilience to co-infections is going to be much more effective than single infections. And then in the first presentation, talking about the diagnostics, this particular study was mentioned as well. And this is one that's commonly referred to when we're talking about the cost of production when it comes to single versus co-infections. This is the Diukis-Hayden and Holtkamp study done in 2012. And you can see that they looked at single infections with Mycoplasma pneumoniae, PRRS virus, and influenza. And the difference from baseline, the MCT, is the mortality culls and tail-end pigs. So we combine those together and looking at the effect of production based on mortality culls and tail-end pigs, and then also average daily gain. So I circled the co-infections that were also evaluated with PRRS and myco, PRRS and influenza, and then influenza with mycoplasma. And you can see the percentage of the mortality culls and tail-end pigs is much higher, and in most cases is a synergistic effect. And you can also see a synergistic effect of the difference from the baseline and average daily gain when the pigs were co-infected versus when they were dealing with the individual infections. So I wanted to present some other data that was more recent rather than historic. And this is a study that's a little bit more complex, but I think interesting. It's another Holtkamp study that was just presented here in 2017 at the IAV-S meeting that was held in February. And they had a student who took oral fluids over time within one production system but multiple flows. And with the oral fluids, they were doing, like Jorge had described, with surveilling the disease status of the pigs, detecting our primary agents such as PRRS, flu, mycoplasma, and porcine circovirus. What they did is they used a k-means clustering effect, which is a process to try to group similar production systems together based on a particular parameter. And in this case, they were looking specifically at mortality. And I wanted to present the pigs that were positive for influenza on the left. And you can see that the pigs in the second cluster, which is the graph presented there, are those pigs actually that had a low pathogen burden at placement, highest pathogen burden during the nursery, but they also then had the highest mortality. And it would be at the 10% versus the other two clusters at 7 and 4 that had a different profile for their pathogen burden. And we see something similar with the PRRS infected groups, having that cluster 2, which is again low pathogen burden at placement, high during the nursery, also having the highest mortality. And so when we looked at those in that particular profile, what they did next is they combined the clusters together. So really we're representing this more as a co-infection status, looking at those pigs that had both influenza and PRRS based on, again, this clustering status. And here you can see that the PRRS cluster 2, shown up at the top in that middle column, and then the influenza cluster 2, did have a higher percentage of mortality when the two groups were combined compared to the others. And so again, my goal with this was to present how the co-infection represent a higher mortality than what was represented with the individual infections. What's the reason behind the effective resilience on these pigs when they're dealing with co-infections versus single infections? I like going back to this diagram here that was presented in the Opresnik paper. If you look at the lower part of the diagram on the left, it would depict what we could experience with single infections, viral or bacterial, that are uncomplicated. Those pathogens have the ability to replicate, but without other cofactors would cause a typical disease process. Replication would remain under control, and then the pathogen would be cleared and either remain as a subclinical infection or the pig would come back to normal. However, on the right side, when we look at cofactors involved, such as other pathogens that can be involved in the infectious process, as well as other factors that are incorporated due to the nature of the pathogen, we can end up with more severe clinical respiratory disease. Some of those other factors, when we're combining bacteria and viruses with a primary pathogen, would be damage to the respiratory tract, immune suppression, cytokine responses that are altered, and effect on our immune function. If we break that apart a little bit more, PRRS infection and its mechanisms, talked about it a little bit with Dr. Harding, but replicating in macrophages and dendritic cells, we see that primarily in the lungs, and a viremia that can occur already 12 hours post-infection, but it alters macrophage function, can change our T cell populations, and damages the mucociliary apparatus. So all of those factors would lead to an increase in susceptibility to opportunistic bacteria or other viruses. With flu, the infection primarily stays within the lung. It doesn't go systemic, but we see a lot of local effects as far as loss of cilia, extrusion of mucus, necrosis and metaplasia of the respiratory epithelium. We see considerable inflammation that comes into the lungs, and cytokines that can play a role in the disease process as well. What happens is a reduced ability of the lung to clear infections and decreases in the macrophage function as well. PRRS and flu co-infections together from a molecular standpoint have been shown in multiple studies to create a more enhanced lung pathology, which definitely would have an effect on resilience and productivity, and a synergistic effect on regulation of some of our innate immune functions, TLR3, which is a toll-like receptor, and RIG1, which are signaling pathways that can be altered to increase the number of or amount of cytokines that are secreted, such things as interferon beta and other cytokines as well. So ultimately, with PRRS immunosuppression and the damage from influenza and upregulation of pro-inflammatory cytokine responses, again, we can see an enhanced effect on resilience. For PRRS and other co-infections that have been described, definitely some effects on resilience there. PRRS and PCV2 co-infections that have been studied, they've seen an upregulation of PCV2 infection and replication, increased tissue distribution of circovirus, and more severe clinical outcomes. PRRS and strep suis as co-infections together have also been described as more severe disease and suppressed macrophage function further than what would be described during single infections, and some similar outcomes with PRRS and Mycoplasma pneumoniae with higher PRRS viral load and potentiated infection with PRRS as well. For flu and co-infections, some of the brief work that has been done is looking at influenza with respiratory coronavirus. There was an increase in interferon alpha, more severe disease in the co-infected pigs. However, influenza replication was unaffected. So we can still see these effects taking place in spite of replication that may be increased or may not. With Bordetella, another interesting study with co-infected with flu, there was an increase in colonization of the bacteria and enhanced production of the pro-inflammatory cytokines and mediators. and exacerbated pulmonary lesions. And not always do we see some of these enhanced effects. Some studies with flu and PCV2 didn't show much of a difference between the co-infected and single-infected pigs, but keep in mind, we have differences in how studies are conducted, and with experimental infections, deciding which one to give first, followed by the secondary cofactor, and the quantity of the pathogen can all play a role in the disease outcome. So then we switch real quick, just and briefly, to looking at the economic impact of these co-infections, again going back to the Stiukas, Hayden, and Holtkamp study in 2012, looking at the cost in American dollars, looking at the bottom chart as far as the single pathogens, Mycoplasma, PRRS, and flu, versus the cost of the disease when those are presented as co-infections. You can see another synergistic effect in the increased amount of cost that results when we have those co-infections taking place. PRRS and influenza control in swine, when we talk about control, we're trying to prevent the actual pathogen from entering a production system or the individuals itself. Then we get into the complexity of what we see from viral and potentially environmental factors. And some of these have been talked about as well already today. But PRRS and flu have a lot of similarities when it comes to both of them being RNA viruses. They have the ability to mutate quite readily, especially during replication with errors that can occur as the genome's being replicated, being able to undergo recombination or reassortment. And so these pathogens are elusive, difficult to create great vaccines that can be broadly cross-protective, but certainly the challenge that we're always working on for the future. Those would be viral effects that can have an impact on resilience. Vaccine efficacy, duration, immunity, and herd stabilization are also complex. Again, looking for vaccines that cross-protect, those that can induce a good cell-mediated immune response, which we think is very beneficial, and the consistent immunity across the herd. So stabilizing herds, I think, is still a challenge and something necessary, regardless of whether it's PRRS or flu. And then biosecurity, of course, continues to be a challenge, preventing new virus introductions and detecting these low-prevalence pathogens or infections. If we're going to be able to clean up these herds and know they're truly negative, we need to have good diagnostic tests and processes in place, which Jorge talked about very well this morning, in order to really know when a farm has become negative. And I think processing fluids have changed some of that philosophy. And the surprise that have been noted by some veterinarians who have called the diagnostic lab when their processing fluids are positive for PRRS when they thought the farm actually was negative. So these low prevalence pathogens, endemic infections, certainly can be difficult to monitor as well without some of these better diagnostic tools. So overall, PRRS and influenza resilience, maintaining productivity when challenged by co-infection is what really the challenge is. Trying to maintain that average daily gain feed efficiency and keep mortality to a minimum when we have PRRS and flu involved as cofactors at the same time. Definitely a single infection, PRRS and flu are costly diseases, but we've seen the economic impact they can have when presented together. And as far as PRRS and flu and the viral or other bacterial co-infections, decreases in the innate immune response and reduced control of infection are a result. Increased cytokine and inflammatory responses can play a role in affecting productivity. Increased severity of lesions would be involved in that as well. And then all of these would suggest an additional time to recovery. So that's what I wanted to present today as some evidence as far as co-infections and how they can impact resilience and productivity. And certainly, I think all of us are well aware of the challenges that can be faced when dealing with both of these pathogens in our production system. So with that, I'll say thank you and turn it over.